Hi, I'm Dr. Alex and I'm a doctor of chiropractic. I often get asked by my patients about frozen shoulder, what it is and what they can do themselves. Frozen shoulder, or adhesive capsulitis, is a condition that affects the shoulder joint. It usually involves pain and stiffness of the shoulder joint that gradually gets worse and then finally disappears. And this process can take anywhere from a year to 3 years. The main symptoms of frozen shoulder are pain and stiffness of the shoulder joint, which basically makes it impossible to move. And this is due to that the shoulder capsule, which basically holds the whole shoulder joint together, becoming inflamed and thickened, which restricts the shoulder joint's movement. You'll typically go through 3 stages of frozen shoulder, and each of these stages have their own characteristics: the freezing stage, the frozen stage, and the thawing stage. The freezing stage is the initial stage, and that is when you start developing pain, which can sometimes be quite severe in the shoulder when you try to move it. It slowly gets worse and worse over time, and it can even be more painful during the night. And this process and stage typically can last anywhere between 6 and 9 months. After that, we have the frozen stage. So in the frozen stage, your pain might actually be much better, but the stiffness is much worse. Moving your shoulder becomes more difficult, and it also becomes more difficult to get through your daily activities. And this stage can last anywhere from between 4 to 12 months. Finally, the thawing stage, when the shoulder starts to regain some of its range of motion and then slowly goes back to normal. And this stage can last anywhere between 6 months to 2 years. Frozen shoulder is a diagnosis that gets thrown around quite a lot. So a lot of people might think they have it, but a very good way to test if you might have it is if we do an external rotation. So if we put our hands like this, and then if we're unable to move it out, either by doing it ourselves or that we're relaxed and have someone try to move it for us, if there is no movement there, then yes, it's quite likely that you might have frozen shoulder. Now, if you're very unlucky to have this condition, what can you do yourself to help? So in the freezing stage, a patient might have quite a bit of pain. So pain management in form of anti-inflammatory remedies such as ibuprofen can be very helpful and useful. If the pain is excruciating and painkillers don't help, the next step might be to get a corticosteroid injection, but be sure to consult with a medical doctor first. Now, throughout the condition, it's also very important that you start working with the mobility and range of motion of your shoulder. The earlier, the better, because you can greatly improve your recovery time. So what we're going to do is we're going to go over a few different exercises for the 3 different stages of frozen shoulder. In the freezing stage, we gently want to start working with our mobility, but mainly focusing on internal rotation and flexion. With the internal rotation, place your affected hand behind your back and with your other hand help pull the affected one upwards. For the flexion movement, we can use a stick or a cane, lay on our back and grab the stick with both hands. Assist with your good arm when performing this movement. You can also do this standing, but this might be a little bit more difficult as you're working against gravity. With these stretches, only pull until a stretch is felt. Do not pull into any sharp pain. For patients who are in the frozen stage, where there generally is no pain involved, we want to focus on our range of motion in 5 different directions: flexion, extension, abduction, external rotation, and internal rotation. With these movements, use the stick again, and with your good arm help push until a good stretch is felt. Do not push your arm into any sharp pain. Hold and count to 5 seconds. For the internal rotation, you can use a small towel or a belt and help pull your affected arm upwards. During the thawing stage, when mobility is starting to come back, but due to the shoulders being inactive for such a long time, the muscles usually become weaker. So it's a good idea to also start with some basic strengthening and muscle activation exercises. Firstly, push your shoulder blades together and activate the back muscles. If we look from behind, you can almost imagine that you're pushing your shoulder blades down into your back pockets. Secondly, you can do the following movements with or without weights. Lay on your stomach, either on a bed, yoga mat or something similar, and perform these movements. Y's, T's, and reverse Y's. You can also lie on the side and work with the external rotation, again either with or without weights. Whatever stage you are within frozen shoulder, it's important that you do these exercises consistently and preferably daily. And if we can do that, trust me, your shoulder will thank you for it.